Diabetes mellitus (DM), commonly known as diabetes, is group of metabolic disorders characterized by high blood sugar level over prolonged period of time. Symptoms often include frequent urination, increased thirst, and increased appetite. If left untreated, diabetes can cause many complications. Acute complications can include diabetic ketoacidosis, hyperosmolar hyperglycemic state, or death. Serious long-term complications include cardiovascular disease, stroke, chronic kidney disease, foot ulcers, damage to the nerves, damage to the eyes and cognitive impairment. Diabetes is due to either the pancreas not producing enough insulin, or the cells of the body not responding properly to the insulin produced. There are three main types of diabetes mellitus. Type diabetes results from the pancreas failure to produce enough insulin due to loss of beta cells. This form was previously referred to as insulin-dependent diabetes mellitus (IDDM) or juvenile diabetes. The loss of beta cells is caused by an autoimmune response. The cause of this autoimmune response is unknown. Type diabetes begins with insulin resistance, condition in which cells fail to respond to insulin properly. As the disease progresses, lack of insulin may also develop. This form was previously referred to as non-insulin dependent diabetes mellitus (NIDDM) or adult-onset diabetes. The most common cause is combination of excessive body weight and insufficient exercise. Gestational diabetes is the third main form, and occurs when pregnant women without previous history of diabetes develop high blood sugar levels. Type diabetes must be managed with insulin injections. Prevention and treatment of type diabetes involves maintaining healthy diet, regular physical exercise, normal body weight, and avoiding use of tobacco. Type diabetes may be treated with medications such as insulin sensitizers with or without insulin. Control of blood pressure and maintaining proper foot and eye care are important for people with the disease. Insulin and some oral medications can cause low blood sugar. Weight loss surgery in those with obesity is sometimes an effective measure in those with type diabetes. Gestational diabetes usually resolves after the birth of the baby. As of 2019, an estimated 463 million people had diabetes worldwide, 8% of the adult population, with type diabetes making up about 90% of the cases. Rates are similar in women and men. Trends suggest that rates will continue to rise. Diabetes at least doubles person's risk of early death. In 2019, diabetes resulted in approximately 4.2 million deaths. It is the seventh leading cause of death globally. The global economic cost of diabetes-related health expenditure in 2017 was estimated at $727 billion United States dollars. In the United States, diabetes cost nearly $327 billion United States dollars in 2017. Average medical expenditures among people with diabetes are about 2-3 times higher. Signs and symptoms. The classic symptoms of untreated diabetes are unintended weight loss, polyuria, increased urination, polydipsia, increased thirst, and polyphagia, increased hunger. Symptoms may develop rapidly, weeks or months, in type diabetes, while they usually develop much more slowly and may be subtle or absent in type diabetes. Several other signs and symptoms can mark the onset of diabetes, although they are not specific to the disease. In addition to the known ones above, they include blurred vision, headache, fatigue, slow healing of cuts, and itchy skin. Prolonged high blood glucose can cause glucose absorption in the lens of the eye, which leads to changes in its shape, resulting in vision changes. Long-term vision loss can also be caused by diabetic retinopathy. Number of skin rashes that can occur in diabetes are collectively known as diabetic dermatomes. Diabetic emergencies. People usually with type diabetes may also experience episodes of diabetic ketoacidosis (DKA), metabolic disturbance characterized by nausea, vomiting and abdominal pain, the smell of acetone on the breath, deep breathing known as Kussmaul breathing, and in severe cases decreased level of consciousness. Rare but equally severe possibility is hyperosmolar hyperglycemic state (HHS), which is more common in type diabetes and is mainly the result of dehydration. Treatment related low blood sugar hypoglycemia is common in people with type and also type diabetes depending on the medication being used. Most cases are mild and are not considered medical emergencies. Effects can range from feelings of unease, sweating, trembling, and increased appetite in mild cases to more serious effects such as confusion, changes in behavior such as aggressiveness, seizures, unconsciousness, and rarely permanent brain damage or death in severe cases. Rapid breathing Sweating, and cold, pale skin are characteristic of low blood sugar but not definitive. Mild to moderate cases are self-treated by eating or drinking something high in sugar. Severe cases can lead to unconsciousness and must be treated with intravenous glucose or injections with glucagon. Complications. All forms of diabetes increase the risk of long-term complications. These typically develop after many years 10 to 20, but may be the first symptom in those who have otherwise not received diagnosis before that time. The major long-term complications relate to damage to blood vessels. Diabetes doubles the risk of cardiovascular disease, and about 75% of deaths in people with diabetes are due to coronary artery disease. Other macrovascular diseases include stroke and peripheral artery disease. The primary complications of diabetes due to damage in small blood vessels include damage to the eyes, kidneys, and nerves. Damage to the eyes, known as diabetic retinopathy, is caused by damage to the blood vessels in the retina of the eye, and can result in gradual vision loss and eventual blindness. Diabetes also increases the risk of having glaucoma, cataracts, and other eye problems. It is recommended that people with diabetes visit an eye doctor once a year. Damage to the kidneys, known as diabetic nephropathy, can lead to tissue scarring, urine protein loss, and eventually chronic kidney disease, sometimes requiring dialysis or kidney transplantation. Damage to the nerves of the body, known as diabetic neuropathy, is the most common complication of diabetes. The symptoms can include numbness, tingling, pain, and altered pain sensation, which can lead to damage to the skin. Diabetes-related foot problems such as diabetic foot ulcers may occur, and can be difficult to treat, occasionally requiring amputation. Additionally, proximal diabetic neuropathy causes painful muscle atrophy and weakness. There is link between cognitive deficit and diabetes. Compared to those without diabetes, those with the disease have 2 to 1.5-fold greater rate of decline in cognitive function. Having diabetes, especially when on insulin, increases the risk of falls in older people. Causes. Diabetes mellitus is classified into 4 broad categories: type diabetes, gestational diabetes, and other specific types. The other specific types are collection of few dozen individual causes. Diabetes is more variable disease than once thought, and people may have combinations of forms. The term diabetes, without qualification, refers to diabetes mellitus. Type 1 diabetes is characterized by loss of the insulin-producing beta cells of the pancreatic islets, leading to insulin deficiency. This type can be further classified as immune-mediated or idiopathic. The majority of type 1 diabetes is of the immune-mediated nature, in which cell-mediated autoimmune attack leads to the loss of beta cells and thus insulin.